Monsieur Martin Griffiths.
Merci, Madame la Présidente. And that's all the French you'll be getting from me, I think. Otherwise, I'll be in trouble with the British, as you know. So thank you very much indeed for this opportunity to brief the Council today, and I'm very grateful to you also for allowing my colleague to sit in for me once I've made my remarks. Thank you very much. That's very thoughtful. Each day that passes only, of course, deepens the misery and suffering of the people in Gaza, and indeed in Israel. The number of people killed in Gaza has reportedly surpassed 26,000, and the number of injured reportedly more than 65,000, according to Gaza's Ministry of Health, the vast majority being women and children. And we've heard these figures before, and they keep mounting, and we've also heard challenges as to whether they are the right source. But this is the source that we have been using for some years. 14 of the 36 hospitals in Gaza are functional, and these only partially. They face severe shortages of medical staff and supplies. Fierce fighting, as we know, has continued in the vicinity of the Nasser and Al-Amal hospitals in Khan Younis, threatening the safety of medical staff, the wounded and the sick, as well as the thousands of IDPs seeking refuge there. The intense fighting around Khan Younis continues to drive thousands of people into Rafah, of course, already hosting over half of Gaza's population of 2.2 million people. Thus, the compression of people in Rafah is a major issue of concern for all of us, but for us in the humanitarian agencies. Across Gaza, over 60% of housing units are reportedly, allegedly destroyed or damaged. We now estimate that some 75% of the total population have been displaced, and their living conditions are getting worse each day. Heavy rains are flooding the makeshift tent camps, forcing children, parents, and the elderly to sleep in the mud, if they can. And clean water is almost completely inaccessible. With little public health support available, preventable diseases are therefore rife and will continue to spread and will become, if they have not already, become the chief killer of Gazans. Madame la Présidente, as I mentioned in my briefing to the Council a couple of weeks ago, the further spread of hostilities southwards, along with the increasing deprivation and desperation of people there, can only be expected to increase the pressure for mass displacement into neighboring countries, the so-called spillover. Some Palestinians in Gaza have already been able to leave through Egypt. In the meantime, there are seriously injured or sick patients unable to receive cure in Gaza, for whom medical evacuations should be swiftly facilitated. And we know that this is a matter of daily negotiation in the COGAT group, which meets daily to discuss all the matters of logistics and plans of the humanitarian operation. Of course, I want to say that these evacuations is in line with international humanitarian law, which in certain circumstances encourages arrangements for the evacuation of the wounded and the sick, persons with disabilities, older children, and pregnant women. I personally vividly remember removing those categories of people back in 1997, can you imagine, from the Tingi camp in the Congo, in the Kivus, and they were allowed out before the attack on the camp came. I also want to emphasize once again that any persons displaced from Gaza must be guaranteed the right to voluntarily return as international law demands. Madame la Présidente, I know you heard yesterday from my good colleague, Under-Secretary General Sigrid Kaag, the Senior Humanitarian and Reconstruction Coordinator, to give her clunky title, regarding her efforts to expedite the delivery of humanitarian assistance to Gaza. The ability of the humanitarian community to reach the people of Gaza with relief remains grossly inadequate. And to say it's grossly inadequate, as it says here, is grossly inadequate. It's much, much more difficult than that. And I was in a conversation yesterday with a senior director of the World Food Programme who had just come out of Gaza and who said it's the congestion, it's the rains, it's the lack of certainty about what tomorrow will bring, as well as the lack of fuel and supplies and deconflictions, as much as anything else, which makes a humanitarian operation so difficult. But it's not for want of trying. Despite the hazardous conditions on the ground, we're distributing food items to shelters, supporting the remaining bakeries, and I think WFP is also doing this through cash assistance. We're delivering medicines, we being, of course, WHO, MSF, and others, and medical supplies and helping to relocate patients. Water, hygiene kits, cleaning kits, tents, tarpaulin sheets, blankets, UNICEF, and others, IOM. But all of these supplies in quantities that are, of course, far from adequate, given the numbers of people compressed into this tiny, congested, muddy part of the world. So if the people of Gaza are to receive anything approaching the amount of humanitarian assistance they need and deserve, urgent steps must be taken. I'm sorry to repeat things that you will have heard before. First, we need to be able to deliver and distribute supplies safely. This means we need significantly improved security assurances. We need to be able to rely on deconfliction there as we need to rely on it elsewhere. Second, a predictable flow of supplies. One of the very human parts of a humanitarian operation, especially in circumstances like this, and we've heard it in Gaza, is how important it is for people to know when the next round of supplies is coming, so that they know that they can eat this food now, because by next week there will be more. Finally, we need, of course, rapid and unimpeded access. We need to be able to enter Gaza via multiple points from Egypt and Israel. This would help clear bottlenecks, speed up delivery of supplies. We continue to face the issue of the rejection for entry of much-needed items into Gaza by Israel for reasons which are, at least to us, unclear and inconsistent. And as we know anecdotally, the whole truck gets sent back if there are items on it which are possibly dual use and therefore prohibited. We need to have access to civilians in need across Gaza. At present, our access to Khan Younis, the middle area, and North Gaza is largely absent. A colleague of mine is on his way to make a second assessment in the north as we speak. Jamie McGoldrick, our Red Humanitarian Coordinator, Deputy Special Coordinator, is leading efforts to scale up operations in critical areas. Jamie is a very practical person with huge experience in humanitarian operations. He used to work for me 30 years ago in the humanitarian predecessor of OCHA. And he looks at these matters in a very practical way, and he is able, therefore, to put forward plans and requests to the committee that meets nightly, I think, the so-called COGAT committee, based on a very, very practical and experienced thing. He's not asking for the moon. He's leading efforts to scale up operations in critical areas. He's very worried, as he says to me in these last days, about whether we will succeed in meeting the needs that we need to meet, especially if we're all lucky enough to see a pause, to allow more in. We've also had difficulties getting access through Keresh Shalom in recent days because of demonstrations. I think we were able to get in yesterday, I think also today. And of course, Sigrid is working on the so-called mechanism to improve, analyze, and expedite the tracks of aid going into Gaza from outside. The breadth of the humanitarian community, including UN agencies, NGOs, the Red Cross, and the Red Crescents, is collaborating to ensure that aid reaches people in need to the greatest extent possible. You will not be surprised to hear that the beating heart of all this is UNRWA. You will not be surprised to hear that UNRWA has provided shelter, it has provided food and water, it has provided medical assistance. All this even while its own staff have been killed, injured, and displaced. I am firmly one of those appalled by the allegations, the accusations, not the accusations, but the idea that some UNRWA employees were allegedly involved in the attack of Israel on the 7th of October. I have seen the movie. These allegations, as we heard yesterday from the Secretary General, are being swiftly looked into, are being addressed transparently, and I'm very pleased to note, and I've had many conversations with Philippe Lazzarini and others, that UNRWA has taken swift action on this evidence, and an investigation is already underway. But UNRWA's life-saving services, as was mentioned by so many member states yesterday, to over 3/4 of Gaza's residents, should not be jeopardized by the alleged actions of a few individuals. It is a matter of extraordinary disproportion. Likewise, UNRWA's support for Palestinians in need in the West Bank. We seldom talk about the West Bank because Gaza, of course, is the center of gravity of this terrible tragedy. But we have significant concerns over the worsening situation there, as well as in Lebanon, in Jordan and Syria, must also be safeguarded. It's tragic to think that the small steps that we have been observing and that we discussed in closed session the other day on Syria are at risk because of these events. But to put it very simply and bluntly, our humanitarian response for the occupied Palestinian territory is dependent, completely dependent, on UNRWA being adequately funded and operational. And you can be sure that we will all be spending all our efforts to try to make this happen and to make it happen in a way that meets the requirements of neutrality and assurances to those interested. UNRWA is playing an indispensable role in terms of distribution, warehousing, logistics, human resources, 3,000 staff responding to the current crisis. Our deputy humanitarian coordinator for Gaza is the UNRWA director for Gaza, because we chose him because he had the greatest knowledge of what was happening and the greatest reach of what might be used. So, of course, we would like to see decisions to withhold funds to UNRWA revoked. Madame la Présidente, in closing, I repeat, of course, my request and demand for compliance with international humanitarian law, including the protection of civilians and the infrastructure they depend on. Hospitals, medical personnel, patients must be protected. It is quite remarkable in these days, in these recent months, how health institutions, not just in Gaza, not just in the occupied territories, but in different parts of the world, how health institutions have become a target of all things, as well as humanitarian aid workers of all people. So I reiterate my call for the immediate release of all hostages. I have met them and their families as well. Unconditional release, humane treatment, and of course, I cannot end without repeating the appeal of our Secretary General for a humanitarian ceasefire so that we can start rebuilding Gaza and giving its families a sense of a future. Thank you, Madame. Merci.
Je remercie Martin Griffiths de son exposé et je donne maintenant la parole